This week's news is going to be just a little bit different. We're very singularly focused, but I think it's really important for us to know. And this all actually tipped me off on like a deep search today when I saw one of our good friends, Dr. Lynn Towell, posted on his group's page, which I'm a member of, called Raving Patients. And he posted something which we'll kind of get back to in a minute. And I thought, gee, I wonder what the story is behind all of this change in regulation, et cetera. And I kind of got into a bit of a rabbit hole. So let's dive in a little bit deeper. So in August of this year, the FTC did come out with some pretty clear language on reviews. And we haven't really talked about it. And frankly, to be totally transparent with you, it didn't really hit my radar. We did talk about the FTC's ruling on non-competes, but we didn't really dive into the reviews. And why wouldn't we? Because so many of us as private practitioners sort of live and die or get our feelings hurt or have to deal with the agony and emotional distress of a negative review. And how do we manage that? Do we respond? Do we not respond? Knowing that we're parts of the community and we want to have a good forward facing presence online. And so the FTC did come out with some additional language in August of this year about online reviews. And there definitely are a few things that are going to impact dentists that I think would be really important for us to discuss. First, they definitely came down pretty hard on fake and false consumer reviews, customer testimonies, and celebrity testimonies. So if you're using mechanisms for false reviews or fake reviews, actual patients or reviews from patients that aren't actually patients of your office, celebrity endorsements from local celebrities that don't actually use your services, et cetera, or AI generated fake reviews, they're definitely going to start cracking down on that. The big one that I thought probably would impact the majority of our office would be buying positive and negative reviews. Now, I know you would think, are there really dentists out there paying people for reviews? And maybe not in the traditional sense. A patient comes in and you ask them for a positive review and and they go home and hopefully provide that to you. But I've definitely seen, and we were even guilty of doing this probably 10 years ago, different giveaways and contests, et cetera, to get positive activity on your Google reviews. So maybe you say the first 15 people that leave us a 5-star review can be entered into a drawing for, movie tickets or something. We're not talking about a cruise. We're talking about little insignificant monetary contributions, but it's important for you to know that they're actually starting to crack down on that as well. So if that is a part of your marketing program and you are trying to drive review traffic through contests and any type of monetary contribution to patients to leave those reviews, that could be up to scrutiny from FTC, and they could smack down, I guess, some type of fine or shut your Google review service down. I have no idea. They were also a little bit more clear on review suppression. So you can't go after people who leave you reviews that you don't like. Certainly if someone's doing false reviews or posting something negative about your practice that is unfounded, they're not even a patient of record, an ex-employee, whatever that might happen to be, there is a mechanism to report it, to try to get Google to pull those down. But you can't technically go after someone who goes online and gives you a 1-star review because you made them take radiographs, for instance. And so, being mindful of the fact that we have to have this controlled space in which consumers do have the freedom to express their opinions about your services, whether you agree with it or not. I do know that the rules or the demeanor, I should say, on responding to those reviews has changed a little bit. Ensuring that you're HIPAA compliant, because there definitely have been a few individual dentists that have gotten smacked with significant fines for violating HIPAA rules when responding to reviews. So that's vitally important. But there is some activity coming back on responding to reviews in a collaborative, non-confrontational mechanism, maybe fact-finding mission, et cetera. Certainly you can do that without disclosing any HIPAA. And then also using fake social media indicators like bots, et cetera, to buy followers, influence on both social media platforms and Google. So I would encourage you to take a peek at it, particularly if you have a very robust marketing program in your practice where you are using a lot of these different activities to drive patient volume in, to drive growth and activity on the social platforms. You probably want to make sure that you've reviewed that ruling, which was in August of 2024, to make sure that you are in compliance with those particular rules and regulations. Not that you can't do it until you get caught, and then you may be either shut down or levied some significant fines. How did this come about today? Well, Dr. Lin Tao posted that Google is now flagging different accounts for potential fake and false reviews. So if there's some algorithm, and a lot of people were posting, like, well, how do they know if it's a false review or a fake review? And there was some hypotheses about how they might be trying to determine that. I don't know if it's an exact science, probably not, based on my observation of many other things within the Google review system. But they're putting this little disclaimer underneath accounts now if they suspect that you've either paid for or are filling your review system with a lot of fake reviews. So I think it's worth noting, certainly worth watching for in case that is one of your mechanisms for marketing. If you think you might be a potential target, you might want to cool that off. Use some of the trusted partners that are out there that are helping consumers drive consumer reviews back to patients' practices. And there are a lot of really great software services out there now that understand all these algorithms and go out and organically capture those reviews for practices so they can grow. And I think those are working really well for a lot of folks. But, I think it's worth a re-look at how you're running those marketing programs. The rules have changed. They certainly have changed since we started our practice about 15 years ago. And you don't want to be caught with fines on something quite so silly. And with that, that's the news.